a little bit because I would love to hear like if you have any at the top of your head, like what are some of like the grossest or more peculiar things you've seen as a clinician that like maybe you didn't expect when you started this as a career?
Oh man. Well, how I don't know how gross you want me to get.
I don't mind. I gross it up.
Okay. So, I mean, working in dermatology, we don't see that. Well, the skin can be kind of gross, right? I mean, just depending
Mm.
on if there's a rash or if there's someone's not taking care of a growth that they've had. But I would say the grossest thing I've ever seen, and I apologize in advance for those that have weak stomachs, but like I said, I used to work with a lot of skin cancers, and I'd work with the surgeon and the dermatologist to remove skin cancers. We had this one patient who would come in every week. Tuesday would be our surgery days. It's called Mohs surgery. It's the surgery that they do to remove the skin cancers. And he'd come in every week. He lived in a really sunny climate full of skin cancers all over his body and his face. And there was one week that he missed. He didn't show up for his appointment. So he comes in the next week on the schedule, and the spot that he was supposed to get removed, it was on his temple. It was black. It was actually necrotic skin. So when the skin dies, it turns black.
Wow.
And it was a skin cancer that kept coming back. And I wasn't in the room, but I was in the next room with another patient, and everybody, there's a lot of chatter going around the office about what's going on in this room. And to the surgeon's surprise, he removed the black necrotic skin as he's removing the skin cancer, and there was actually maggots living underneath that black necrotic skin.
What?
So it wasn't on top. He couldn't see
Hold on.
them.
So it was right here.
Right.
I'm pointing to
It
my
was like a
temple.
huge. It was like a huge spot, like about a $quarter size.
Okay,
And
like a quarter. Okay, so it was a big black spot. He took it
right.
off, and there
And
were how do maggots even get in there?
so he had told the surgeon, he's like, "Yeah, I've had to pick off a few flies from my skin." So the flies were
Oh my
landing
gosh.
on his skin, laying their eggs, and the maggots were, I guess, hatching underneath this necrotic tissue. So he couldn't feel them. He couldn't feel them because this whole area where he had the skin cancer was being cut out so often that all of the nerve and the feeling was gone. So he couldn't feel anything moving inside there. So that was definitely the grossest thing I've ever heard. I didn't see it in person, but of course they took a picture